Hello, everyone. It's Dr. Ahmed Rehan Khan here. Today, we are honored. We have Dr. Rifat Sabir with us. She is an internal medicine program director at University of Massachusetts Chan Baystate. I have requested her to be here. One thing which I really liked about her program, and I shared that on X and LinkedIn, is the transparency because again, I have been advocating on different forums about how residency programs should be more and more transparent, especially for IMGs, because IMGs are applying mostly for internal medicine above 100, 150 programs. And if program has a set criteria which they share on social media or their website, that can really, really help applicants. And her program was, I think, one of the most transparent criteria I have ever seen. So, without further ado, I would like to thank and welcome Dr. Sabir. Dr. Sabir, good morning and good afternoon, actually, and thanks for joining.
Thank you so much, Dr. Khan. Thank you for having me.
Absolutely, it's our honor. Can you please tell us a little bit about your residency program?
Of course, so we are based in Springfield, Massachusetts, which is the largest city in Western Mass, third largest in entire state. Not everyone would know that Springfield is the birthplace of basketball, and Dr. Seuss, who's the well-known children's book author and
Oh,
illustrator.
I did not know actually.
Yeah,
Interesting.
and also Springfield used to be the leading center of industrial revolution back in 19th century, and we know that there are a lot of Springfields in US, I think more than 25, but we
Abs-
were the first one. So now our institution, Baystate Medical Center itself, is really a historic institution, has a long and illustrious history, spanning back to 1870s, if I'm not wrong, when it first opened under the name of Springfield City Hospital. And the establishment is remarkable because it predates some prestigious institutions as Johns Hopkins and Mayo
Oh,
Clinic.
wow. Wow.
Now, Baystate has transformed in so many years. So it's an integrated nonprofit health system with 5 hospitals, more than 80 medical practices, 13,000 employees, 1,600 physicians. But most importantly, we have been here for more than 145 years, providing care to a population of more than 800,000 in Western Mass.
Wow.
So our hospital where we are is Baystate Medical Center, is a 746-bed state-of-the-art integrated academic health system. It is a major tertiary care federal level 1 trauma center, but also regional campus and teaching site of Bird's Track for UMass Chan Medical School.
Okay. Oh, excellent, excellent. And if I may, I would also like to ask you, can you tell us a little bit about your own journey being an IMG from Pakistan, how you ended up being a program director at one of the most desirable places for IMGs?
Of course, thank you so much for asking this question. So it's like my profile I recently updated on LinkedIn, so it's all there. I graduated from Lahore Medical and Dental College back in 2007. And the journey was not intended, took different paths for me until I landed here. And I would definitely give a lot of credit to my social support, and that being my husband, who was my mentor through and through during this time. Also, we used to have Step 2 CS back in the day, so my
Yes.
standardized patient for Step 2 CS exam as well.
Oh, wonderful, wonderful.
So a bit about the journey. I actually completed my residency training here at Baystate. Then I did an extra year of chief residency in this institution. And then I continued to grow here first as academic attending, then as assistant program director, and eventually as a program director. So this is my third year in this role.
Wonderful. So you have spent your entire clinical career at Baystate.
Yes.
Wow, I mean, I think that is, for me personally, that is one of the best feelings that you start at a place as an intern and then you progressed as a program director. That is one of the, I think, the most beautiful things one can hope for. So thanks for sharing the journey.
Thank
Uh,
you for your kind words.
and as you may have, I shared some of my podcasts. So what I usually try to do, these podcasts, uh, a lot of IMGs apply to internal medicine. Of course, first is because we need more and more people in internal medicine, whether they're hospitalists, primary care physicians. And then, of course, after internal medicine, some people opt for fellowships. So internal medicine has the maximum number of seats. I think last time I checked, it's what, 6,600 or something? So around that. So
I think you're right about that.
yeah, I
About
think something around that. And I think that for IMG, especially I think from Pakistan and India, East Coast, Northeast Coast has always been a desirable place. New York, New Jersey, Boston, Northern Virginia, DC. These are the places. And especially I think Boston and areas close to Boston, Springfield, even Salem, because they are so rich in the culture and a lot of what I have seen is a lot of people, their spouse would not be a doctor, they would be doing PhDs. And so there are so many opportunities in and around Boston, Springfield area. So I must say that it is an extremely desirable place. So IMGs, when they apply, when I applied back in 2015, 16, I was very anxious,
right.
stressed because I am from Sims. It was one of the newer colleges at that time. So we did not have that kind of alumni support. And I was very lucky that people from King Edward, Nester, other medical alumni, people from India, people from Middle East, they all really helped me, guided me, and but even with then, I actually matched at my second attempt. So since then, what I've been trying to do is I've been trying to connect with leaders like yourself so that we can put out a message that what are some things that applicants can do to make them a more competitive applicants, and more importantly, some things that they should not do.
Right.
So, with your permission, is it okay if I start asking a few questions?
Of course, yeah, please go for it.
All right, thanks a lot. So, my first question would be that it's regarding filters.
Yeah.
So, your internal medicine residency program, does it have any hard or soft filters?
Thank you for asking that question. So that was actually on our social media post also. The only filter that we use in our program is year of graduation filter. So that's a 3 year since graduation filter that we use. That being said, we do make exceptions,
Okay,
and exceptions based on what were you doing? Like if you graduated more than 3 years, 3 years ago, what have you been doing this time? If you spend 3 or 4 years in your home country doing residency training, then I'm certainly going to give emphasis to that.
right.
Also, if you spend that time doing research or gaining hands-on clinical experience in US, then yes, I'm not going to disregard that time.
Okay, that's very important. Okay. And my understanding is that a program such as yours, you all may receive over 4 or 5 thousand applications around that. Is that true?
Ours was slightly more than that. So we received 5,000, closer to 500 applications last year.
Wow, 5,500. Awesome. But again, that creates that is a lot of work. So I'm sure that you may have like a system. Do you mind telling us what kind of a system do you then use?
Of course, yeah. So we have a very systematic approach to handling the applications. So as soon as we get access to application, me and my program administrator, we go right in and we divide people into different cohorts. And those cohorts being US allopaths, US osteopaths, and then international medical graduates.
Mhm.
Personally, I don't feel that it is reasonable or even appropriate to compare a USMD with an international medical graduate because their life journeys are so different, their experiences are so different. And what brought them to this place, all those circumstances are so different. So it's just not fair that I do that comparison.
Mhm.
So if I'm going to compare a US allopath, I'm going to compare them with their peer. And if I'm going to compare an international medical graduate, I'm going to compare one with the other. So that's why we split people into different cohorts. And then, so within our program, we are a big program. So we have 3 associate program directors, 2 assistant program directors. So I have a lot of help. So, but then at the end of the day, I do end up reviewing chunk of applications because I get more administrative time to do this.
Okay.
So then we assign applications. We have certain criterias, like what do we put emphasis on? And I must have, we did conduct an open house recently, and I said this out loud also. We put a lot of emphasis on experiences. and the quality of experiences.
Okay. That makes a lot of sense. Um, so with that, uh, my question would be that how impactful are USMLE scores? Of course, right now, step one being pass fail. So how much emphasis your program and you put on CK score?
Thank you for that question. And an extremely honest response to that is we have evolved. So when step one changed from score to pass and fail, it was not this past year, but year before that.
Mhm.
We had some applicants who were pass and fail, some applicants had scores, and then we had complex scores. So
Mhm.
then we treated everyone just the same.
Mhm.
And that then we treated everyone as pass and fail, and we did not look at their scores, which made me wondering that applicants that apply to residency programs, they should be treated as more than numbers.
Absolutely.
So then we stopped looking at numbers altogether last year.
Wow. So
So we
not
don't
even
look at
CK
numbers.
score.
No, we don't look at the numbers at all.
That is such a wonderful thing. I mean, I'll be honest, I have interviewed few program directors and from different fields, but that is like the first time I'm hearing that, and that is like awesome, awesome. So
Thank you.
very good.
But when we have objective criterias, it makes everyone's life easier. You can objectify people,
Mhm.
but then when you take that objective part out,
Mhm.
now it was my responsibility to create a standardized approach to reviewing
Mhm.
applications. So everyone follows the same approach.
Okay. All right.
So then we had to like do over some teaching sessions with all our leadership team. Like this is what we're going to look at, not look
Mhm.
at CK scores, but I'm just going to repeat myself again. Look at the experiences and the quality of
Okay.
experiences.
All right. Now, when you're saying the experiences and the quality of experiences, we'll focus more towards IMGs because AMGs, of course, when they are applying, they are in their senior year, fourth year, and of course they have their sub-Is, their clerkships, co-rotations, and all that. So for IMGs, what do you want to see in their experience, whether it's in US or in their home countries?
So there are multiple things that might fall under this category. One would be, and again, if I'm reviewing an application, I would want to get a person who's well-rounded. We all know that scholarship is important, research is important, number of publications are important. But then also I know that not everyone would have the opportunity to get involved in a research project.
Mhm.
So I cannot generalize this. So when we review applications, we say that, okay, let's look at either research experience or leadership experience.
Mhm.
So we have that option. Personally speaking, like during my medical school, I didn't do a lot of research.
Mhm.
It was like later on when I got involved and my interests evolved. But yes, I was involved in a lot of teaching opportunities. But to answer your question straight, experiences would be scholarly experience, leadership experience, any teaching experience. Baystate, city of Springfield, we serve a lot of underserved populations. So our program puts a lot of emphasis on community outreach work,
Mhm.
volunteer experience. So we look into that as well.
Okay, understandable. And how about what do you think about the US clinical experience for IMGs, like hands-on externship versus observership, clinic versus hospital, and then those compared to the home country, whether it's a residency experience or a non-training experience?
This is a very challenging question that and you may or may not get a very right answer or a straightforward answer to this. I would say it depends.
Mhm.
It depends on the quality of experience.
Mhm.
We both know that hands-on clinical experience is the one that is favored more than observership or shadowing, if they
Mhm.
may call it. Even within hands-on clinical experience, like was it done in an inpatient setting or was it done in an outpatient setting? If it was done in an inpatient setting, then yes, that would be more preferred over outpatient. But also I've seen this in applications. Sometimes it's very hard to decipher. Like as you're reviewing people write externship in such and such place, but it's
Mhm.
very hard to see if that was an inpatient setting or an ambulatory
Mhm.
setting. So this is something I would recommend if people are writing their experiences. Just make it easier for the reader so they don't have to like really dig and dive deeper in your experience to like kind of find out what type of experience it was.
Absolutely. So put things in a way that just by uh, reviewing them in a glance, they should have an idea whether it's an inpatient, outpatient, what kind of setting, what is the place, and what did they do.
Absolutely.
And how about, let's say that if an applicant uh, took past step one, year of graduation is maybe one, have really good CK score, but because since they stopped taking CS, there have been an increasing number of applicants, IMG applicants, especially from countries like Pakistan, Bangladesh, Middle Eastern. They have had difficulty in getting a US visa. So they would be CFMG certified and they would have home country letters. Now, home country letters, I'll start with, let's say that because they haven't started training, but they have home country letters. They are waived and well written,
Yeah,
and they have been active and they have also some research. Now, is that uh, a candidate would you would consider for an interview?
absolutely. And letter of recommendation or your letter writer should be the one who knows you the best.
Mhm.
And it doesn't matter if that letter writer is from your home country or from US, but
Okay.
someone who would really vouch for you and would write not a generic letter, but a letter
Mhm.
that is very much specific to you and the work you did with them.
Okay,
So
absolutely.
that's about the letter of recommendation. And I do recognize all the difficulties that international medical graduates go through to get clinical experience.
Mhm.
If you have clinical experience, that is great. If you don't have US clinical experience, then your experience within the home country is valuable as well.
I understand. Okay. And how important is home country residency training, whether they have done it for a year, 2 year, or more than that? How valuable is that?
It is definitely valuable because that was the time well spent doing clinical work.
Mhm.
I think what becomes more challenging is when there are gaps in
Oh,
someone's CV. Like if you have a gap, make it a point to explain that gap. I
absolutely.
would say that your application should reflect your work. It should be honest, should only reflect the experiences that you have personally experienced.
Understandable.
But if you spend that time doing residency training, take pride in the residency training in your home country
Okay. All
and
right.
put that in your CV.
Okay. Makes sense. The next question I have is regarding USMLE Step 3. You know that, of course, AMGs, their timeline, even for Caribbean grads, it does not allow them. But for IMGs, at times, if they have a visa and opportunities, they can take it. Sometimes they would take it. Now, if someone has passed USMLE Step 3 and IMG, in your opinion, for the sake of your selection criteria, would it be any beneficial at all?
No,
Okay. All right. So
but
for
the way
your program, it won't make any difference.
it won't make any difference.
I understand. All
Because
right.
if I'm not expecting USMLE Step 3 or Complex 3 from allopaths and osteopaths, then it's not fair that I expect from international graduates.
Absolutely.
That being said, if you have time, then go for it and take it and get it out of your way. Also take it if you are considering H-1B visa sponsorship.
Absolutely. Because you cannot get H1B without that.
Right.
Okay. All right. Uh,
Also, when residency training starts, there's like so much that you have to learn. There's a steep learning curve involved, and then you should not worry yourself thinking about step 3 exam that still needs to be taken.
Absolutely. And that was my point of taking because I knew that I would not be able to take it during my residency because I was a psych resident and I know that in psych we have to also do internal medicine and neurology. And some people actually took during those rotations and I salute their courage, but yeah, I would not have done that.
Mm.
So I agree that just getting it out of the way can be very helpful.
Yeah, I also took my step 3 before residency and before starting residency. But our residency program, actually not only our program, our institution, we reimburse fee for USMLE step 3 and
Oh,
complex
that's awesome.
if
That's
taken during the first 18 months of
okay.
residency.
All right. That makes a lot of sense. So you mentioned about research, the scholarly activities. Now, again, for IMGs, So I know that what some people do, some online peer review articles, of course, some people are so advanced that they are doing their postdocs. So what, in your opinion, what could be at least a bare minimum level of research that if it's in the CV, that does tell something about the applicant that they have some research skills?
Yeah. As you were saying, research comes in different forms. You start from a meta-analysis, systematic review to randomized control trial, which we know that, yes, it is gold standard. If it gets done within the time, it's wonderful. But let's be realistic here. It's not going to be ready by the time
Mm,
you are applying for residency. So be realistic here. I would encourage residency applicants to get involved in QI work.
mm,
Quality improvement work is still powerful. It not only serves you, but serves your institution and your
mm,
community, but also can be accomplished in a certain time frame. Like
mm.
you work on an idea, a project, and everything is done in a few months. Um, Personally, my area of interest is medical education. So, medical education research or scholarly work. All you need is an idea and then a place to implement that idea, and then you can do a pre and post and get work done. But if you don't have access to those opportunities and you came across some cases, you can definitely write down a case report. You can get that published. If you are in US, you have the opportunity to attend a conference. I would encourage people to do that.
Mm.
That would be a great avenue for you to develop some connections.
All right. And then if they present a poster at any conference, would that be also a plus?
Absolutely. That is also a form of scholarship.
Okay, I
So
understand.
absolutely.
All right. Okay. Then I will move to our next question. So signaling is it's something that started a couple of years ago, and this year they have advanced it to I think a total of 15. I think there's three golden and 12 silver signals. So as a program director, how impactful signals are for you and your team, and then what would be your recommendation to the applicants?
Of course, so signals are one of the criteria that we look at when we are reviewing applications alongside geo preferences. So as I had mentioned, our program received 5,500 applications last year. So it does get very challenging for a program to review everyone and for a program to know who's like really interested in coming to them. So signal is certainly a way for you to tell a program or program director that I'm interested in you. But I would also tell applicants here that use your signals wisely.
Mm,
You only get so many, and I'm sure that for our international medical graduates that apply widely to multiple programs, you only have 15 programs to signal.
mm,
Uh, do research on that program, see what percentage of international medical graduates do they have, and then if you have ties to that program, that would be wonderful. But choose your signals wisely. This would be my one advice to the applicants.
understand. Now, previously, personally, I felt that the geographical location, some people would say, especially until last year, that you don't actually have to mention, especially for IMGs, because it gets complicated. But this year, some people have been advocating that you should double down with your signals as well as signal the programs in the specified geographical location that may enhance your chances of getting an invitation from there. What would be your opinion on that?
I would agree with that comment. Like if you're signaling a program, so for us, our geo preference is New England, but New England is like broad. There are like six
Mhm,
states within New England. So
mhm,
there's like a lot of programs that fall within that geo preference.
mhm.
So that really tells me that yes, you are interested in my program and you're interested in our area. But if you have no ties to the area, no family ties, no social ties, and you want to leave your options open, that's a fair point as well.
I understand. That makes a lot of sense. There has been a lot of questions recently about the impactful experiences that I think out of your 10 experiences, you can designate three experiences to be the impactful. I did some seminars through UpNa and a lot of people asked that. And actually, I would be honest, I did not know much about it. I did some research on it, asked around some people. So I would like your opinion on that what should be those impactful experiences and what kind of experience could be impactful?
Thank you so much for asking that question. I'm just going to preface by saying something. So, when you're reviewing a lot of applications, and that too applications of competitive applicants, and I'll say everyone who's applying to a residency program is a competitive applicant in their own unique way. So now you're reviewing applications of thousands of competitive applicants. You reach a point where all the applications start looking just the same. And I'm openly admitting this. There are certain areas in the applications, though, especially for me. So I don't want to generalize this perception. This is my personal opinion. There are only few areas when you can like truly see the real person behind Eris application. That makes an application a bit humanistic, for lack of better words. One of those areas is personal statement. Second area is impactful experience, like a dedicated box that you get. And the third area is writing meaningful experience under each experience. So then now coming back to your question, what makes an experience impactful? Like there are certain categories and they mention what you could write. Like if you're a first generation college student, I would say if you're the first doctor in the family, if you had certain hardships in your life. Yeah, people, our residents who are applying for fellowships ask this question like, I come from a very privileged family and I had no hardships in my life. And I have no idea what to write in there. And I was like, okay, let's dig deeper. And then we had a conversation and we always came up with something that was worth mentioning.
I
So
understand.
I just want to tell people that it doesn't have to be a hardship.
Mhm.
It has to be something that transformed you to a person you are today.
Absolutely. And exactly, cannot agree more. That's what exactly that we were trying to emphasize, that the main thing is that how it is impactful and why it is impactful to you. What impact did it make on your life? And even that if it made an impact, how did it change you? Or, I mean, at least help you evolve. So I totally agree that does not necessarily have to be a very sob story or something really significant happened. But if even if it's a small thing, and it made an impact in your life and it made you a better person, better physician, I think that's definitely worth sharing.
Absolutely. You know, our profession, any profession, but especially healthcare profession, is about self-discovery.
Mm,
Like as we mature in this profession and as we evolve, we discover so many things in us that we didn't know existed. So
mm.
you could write about your self-discovery during medical school.
Absolutely. Cannot agree more. And as you mentioned, personal statement. Uh, there has been a lot of debate about it, that some people have mentioned frustration about seeing the same pattern over and over again, of unfortunate illness or death of family members sparking interest, and so on and so forth. What's your opinion about personal statement and the concept that they are very monotonous, and what can an applicant do?
Yes, I was actually going to bring that up until you did. Don't fall into the trap of a standardized personal statement. And standardized personal statement, exactly what Dr. Khan said. Like something that happened in your life, like a death of a family member. Second paragraph is always about a patient, and third and fourth is about why this field. I know that people might write their own personal statement, might hire external services. It's totally up to you how best you want to narrate your story. But then that should be your story. That should be unique to you and unique to your journey, unique to your motivation. As personal statement I was alluding to earlier adds a human element to application. And sometimes people that are reviewing application, it helps the program see applicants, see you beyond your scores and accomplishments. So it should certainly highlight your unique qualities, your unique experiences. And sometimes as I'm reading the application, it also helps me determine how good is someone's communication skill, how well you can organize your thought, communicate your ideas. If you have gaps in your CV, this might be a good idea to explain that gap. If you have any attempts, this might be a good place to highlight the attempts. Otherwise, also use this time to outline your vision for your future career.
Absolutely. Makes a lot
But
of
it should be your unique story
Mhm.
and it shouldn't follow a standard template.
Absolutely. My next question is about the residency interview itself. So, of course, You receive 5,500 applications. Let's say you narrow out to 400 people, 500 people you interview, and when you interview them, in making the final rank order list, is interview performance the only metric when you are making the list, or even the pre-interview, some credentials would also play a role in that?
For us, it's almost half and half.
Okay.
So as we are reviewing applications, we start scoring applicants at the same time, and we score them based on their experiences. And then the half and the rest of it is actually your interview day and how that went and how well you answered the questions. And for us, it's really comes down to how well you align with what we offer here in our program and the values of our program.
Makes a lot of sense,
Yeah.
right?
And then by the end of the interview day, we come together. So just so everyone knows, we have three interviewers. So I interview all applicants on that day. Then we have one of our APDs and then one of our chief residents.
Okay. Makes a lot of,
So
and
all of us, we have standardized questions and
okay,
we have
all right.
pre-assigned standardized questions, and they were done to reduce inter-rater bias,
Mhm,
inter-rater variability. So all of us, we score applicants there
mhm.
and then we create an average. Then we have an average score of three interviewers.
I understand. Okay,
Yeah.
makes a lot
So
of
if
sense.
you were wondering, does it matter if you interview with us early on or later in
Mhm.
the season? I would say no.
Okay, that again, that clarifies a lot because that's also a notion among some applicants that maybe interviewing late is better. Some would say interviewing early is better. So that actually clears a lot of stuff, at least in regards to your program. I
Yeah.
understand. Okay. Now, my next question could be maybe a complicated one, but
Sure.
that's what a lot of people actually sent me questions that they talk about red flags. And as I think you also mentioned, again, for me, a red flag would be an attempt in your steps exams, whether it's step one, CK, people, older graduates had even CS attempts and even step three attempts. And then some people would say year of graduation more than 5, 7 years. Uh, some people would even say not having any US clinical experience. So we'll just start with the attempts. Now, in your opinion, if someone has an attempt, is it a filter that potentially your program use and it can be overcome by like other experiences? Or if someone has an attempt, would it dent their chances of getting an interview? And what can they do to overcome that?
Of course, yeah, yeah. So we don't have any filter for attempts.
Okay.
We review applications with attempts also. And me and my program administrator, we have this conversation so many times that we feel that everyone deserves a second chance. And when people don't clear an exam, there's always a reason behind it. Not everyone is as privileged to have a very sound social support system,
Absolutely.
whatever the reason might have been behind the attempt. So we personally feel that everyone deserves a second chance. So we don't filter applicants based on attempts. That being said, if you have an attempt, and I don't want to generalize this notion by any way because different programs use this information very differently. But I would suggest that if you have an attempt and you want the reader to know why that attempt happened, just have it somewhere on your application, either in your personal statement, but if you're worried about being it in the personal statement, then under impactful experience, just tell the person why that happened.
Mhm. Makes a lot of sense. And people who have attempts in like generally, how can they overcome? Because let's say that your program, you're saying, of course, it doesn't, but there are, of course, some programs that would.
Absolutely.
So how can they overcome it, overcome the attempt? What can they do?
Yeah. So, it comes down to there are always two types of factors, modifiable and non-modifiable.
Mhm.
So, you had an attempt, something that is done, and you unfortunately cannot do anything about it. That's an unmodifiable factor. And the same thing about where you went to for the medical school and how many years since graduation you had. So, unfortunately, you cannot do anything to fix that. What you can do is work on the experiences. So you only get 10 slots. You can only write 10 experiences, and out of those 10, three have to be your meaningful experiences. What can you do? Work towards your application,
Mhm.
work towards getting if at all possible, some form of leadership experience, some form of teaching experience. If you are, or if you have an opportunity, go serve your community, go do some volunteer work, and you can have that on your application as well. When it comes to letter of recommendations, ask letter of recommendations from someone who truly knows you, and then invest your time writing your personal statement and impactful experience. And phone a friend, have someone review that for you.
Hmm. Okay. Makes a lot of sense. Uh, there's a term that people use email of interest or letter of interest, that especially prior to signaling, there was a notion that especially IMGs, they would send emails to the coordinators, program directors prior to applying or just after submitting the application. These are my credentials. I'm really interested in your program. Just wanted to have your opinion on that. Do you think it can help, or with the advent of signaling, it has lost its purpose, or what do you think about it?
I would echo what you said. Second, that with advent of signaling and geo-preference, like you have uh, an official way within ERIS to express your interest towards the program. So that has more weightage now, at least in my mind, than letter of interest. Also, to be very honest here, I'm sure it's not only our program, but a lot of other programs receive a lot of emails.
Yes.
And if you're going through the interview season, so when we interview, it's a full day of interview. We have a morning session and an afternoon session.
Mhm.
So I did interviews entire day. I did not get an opportunity to read my emails. And
Absolutely.
when I'm going to come next day, if this is my non-interview day, then I'm going to be in a catch-up mode. So I may not be able to get to your email.
Mm. Makes a lot of sense, and that is very honest, that's what happens.
Yeah, but if you have a genuine question that was not on the website and you want to ask someone, please go ahead and ask that question. If
Excellent.
you interviewed with someone and you want to express your appreciation, I know that now a lot of programs verbalize you don't have to send us thank you notes. If they said don't send us thank you notes, don't send us thank you notes.
Okay.
But if they did not say that out open, it's up to you, then definitely you can go ahead. Thank the interviewers, thank the program coordinator, program administrator, because they do a lot of hard work, a lot of behind the
Absolutely.
scenes work. So do
Absolutely.
appreciate them whenever you get the opportunity to appreciate them.
Yeah. I feel that on a clinical side, the nursing staff and the nursing techs, and on the more academic side, the program coordinator, I feel that they are the frontline warriors.
Absolutely. My program administrator, she's a gem of a person and she does so much work behind the scenes that you cannot even imagine.
Absolutely makes a lot of sense. There has also been a lot of discussion, and I think I should have asked just when we were discussing personal statement, the role of AI. Of course, with the advent of Chat GPT,
Yeah.
Google came out with Gemini, Microsoft came out with something else. There's a crowd, so there are a lot of free softwares out there. Grammarly has come out with an professional AI version as well. What would be your opinion that what is the role of AI? Uh, and have you seen statements that would just speak AI?
So this is an area that so first of all, I won't discourage use of AI. We can say that we don't want people to use AI and we hate AI. It is going to take away intellectual curiosity, but uh, realistically, we know that this is going to expand from here.
Mhm.
So, but should we use AI to write your personal statement? I would say no. Um, ChatGPT is all about giving them the right prompt. So don't give them a prompt. Write a personal statement for internal residency application. We spoke about this at length earlier. Your personal statement needs to be your unique story. So don't have AI write your unique story. But if you have your unique story and you don't know if grammatically it is correct, then you can use AI for grammar corrections, putting in right punctuations, but not to write stuff for you.
And absolutely, I mean, like 100% I agree. I think that's what a lot of people have also told me that if the content is yours, you can get assistance from AI in rearranging or giving it a certain tone. But if the content is generated by AI, then it looks like AI.
Yeah.
So it walks like a duck, talks like a duck. It's that that kind of a thing.
It's just that formal language that you can
Yeah.
like really tell that it was eliminated by
Yeah,
AI.
absolutely. Makes no, that makes a lot of sense. My next question is about the networking piece of it. And of course, one thing you mentioned is people who are here, they go to the conferences. And I
Yeah.
totally agree. Being a psych person, if anyone comes and meet me at American Psych Association conference, or there are program directors there, APDs there, there's AdPert of the program directors and chairs. I think that is really good thing. But people who are not physically here, how about the networking? How should they approach, or should they approach people like yourself and other people on LinkedIn, Twitter, or emails? How is it an okay thing to do? Should we encourage them to do? And if they want to do, then how should they do?
Thank you for asking that question. So I will say that maybe definitely multiple layers to the question, but the first one is one, the importance of networking. I will say that even much more than networking, it would be mentorship to me. Like seeking a mentor is always valuable. Like people who have walked in these, who have walked the path and they can guide you. They can guide you through your journey. Sometimes it's not only about the journey, but it's about their insights. It's about the valuable support that your mentors could offer you as you navigate the residency, navigate everything that is beyond residency training. So seeking a mentor is extremely valuable. How do you go about seeking a mentor? That is a very challenging aspect. And I'm sure you'll agree to this, Dr. Khan, that being a mentor itself takes a lot of you, a lot of your personal time, and you invest in that person. So that is very difficult for the mentor also. And as you're seeking a mentor, you have to find the right person who will invest in you and who will spend time in you and will advocate and vouch for you, everything that goes with a mentor-mentee relationship. And not everyone is fortunate to find that right person in their life. Even me, I have found some incredible people that supported me throughout the journey, but do I call them my real mentors? Maybe not. Up until really later, I found one person who mentored me. And so, what should our applicants do as they're going through the journey? Trying to connect people with LinkedIn, trying to network during conferences. One on one networking is the best thing that you could do. If you are in a conference, a general internal medicine conference, that's the best time to meet residents, program leadership. That might be a good place to start. I know that a lot of medical schools, they have this extensive alumni network. And so make use of your alumni network if you have. They might help you connect with the right people as well. And if you don't have an extensive alumni network, then you can start with networking during the conferences. Now, connecting with people at LinkedIn, sure, you can do that, but I just don't know how much of a relationship you'll develop on a social media platform.
Makes a lot of sense. There's, I think what we have seen over the years that, especially from IMGs from Pakistan and India, I would just talk about Pakistan, that there is not a lot of like focus on the professional communication,
Yeah.
even the concept of calling someone like a sir, starting with that, not like introducing themselves. That is something that I personally and some people in UPNA, we have been emphasizing that. Uh, if you reach out to someone, whether you're writing an email, writing a message on a social media network, it has to be, whether that person is from Pakistan or not, it has to be very professional. That it, I'll tell you one thing, that a lot of messages which I receive is that they will just like start message, greetings, and then they will just without introducing themselves, just ask, like, can you do that? Can you do that? So I often reply to them that Thanks for reaching out, but because I don't know you, can you please at least tell me who are you, where are you from? So, what would be your message about generally to, especially to IMGs, about professional communication? What can they do to improve? Is there any resource they can read or something?
My information or my knowledge might be slightly limited here, Dr. Khan, when it comes to resources. But I'll say that certainly it's extremely important that you be professional with the interactions. Even like referring someone by their first name. Here in US, we know that if this relationship is entirely professional, then it has to be doctor and their last name.
Mm,
You only refer them by their first name, one, when they allow you to do that. And second, if you have known them and you have developed a certain relationship with them, and then it's by first term basis. If you're messaging someone on a social media platform, then please start by introducing yourself, your background, your medical background, some of the work that you have done. Because if you're seeking a connection or if you're seeking a mentorship, there needs to be some alignment within the
mm,
goals. Because why would someone invest in you? Why would someone
mm,
invest their time and their true passion and their energy in you? There need to be some form of alignment of interests because mentor-mentee relationship at the end of the day is a give and take relationship.
mm,
I will give you my time, and what am I going to get in return? Maybe some gratification and maybe some more knowledge about my field of interest. So
mm.
there needs to be some alignment of goals and interests. So express that in your message, in your email to that person.
Absolutely. Well, thanks a lot. That is very important. I'll quickly ask one question, and a lot of people have asked me this question, and honestly, I don't know the exact answer.
Sure.
Usually, people ask, especially the IMGs, that when they're applying for the match, 25th September, if they have submitted the application, the program start reviewing. Now, let's say that at that time, they are not EC certified. Let's say they are waiting for one of their results, whether it's OET or CK results, and it may take 10, 15 to 1 month for them to become ECSMG certified. Now, the question they ask is, should they wait to submit their application when they get EC family certification, or they should submit it and once they are certified, they can let the programs know? What would be your response?
They should submit your application, and once you have all the results available, then let the program know.
Okay, so if as a PD, if you are reviewing an application that does not have, let's say, for IMG especially, let's not have a CK score, would you and it is mentioned that it's in process, would you like entertain that application?
I would.
Okay, all right.
And I always flag is the wrong word, but I would just always refer back to that individual and see if the score came back. The same scenario happened last year also. ERIS allows us an opportunity to message each other. So I messaged that applicant that I'm reviewing your application. I don't see your CK score. And then I got a response back that it would be available by this time.
Okay, that makes a lot. That clarifies a lot of things because I wasn't even sure because so many people ask because some people is of opinion that when they're reviewing your application and it's incomplete, then they would just put it aside and you should apply later. But some people like you yourself mentioned that makes actually more sense to me,
Yeah.
right?
I must say that for again, I cannot generalize this
Mm,
statement, but your ECFMG certificate and your Step 2 CK scores should be available by the time most of the programs wrap up the recruitment season,
mm,
which is like January,
mm.
but definitely before they work on their rank list. Because
Abs-
if your CK is not available by the time I'm working on my rank list, unfortunately, I won't be able to rank you.
Exactly, yeah, that's the main thing for IMPs. Yes,
Yeah.
absolutely.
But
I
also when programs they get access to applications, different programs approach this very differently. For us, it was on social media that we review all the applications. Like we give us ourselves at least a month to review all the applications, and then we do all bulk invites on one day.
Oh, okay, okay.
But then different programs they have different phases or different stages to inviting. So if your application was never submitted and then you missed their phase one, or if you were planning on submitting it in a month later, then maybe you just skip the entire time when someone was going to review your application.
I understand. Makes a lot of sense. Okay. Well, I think this has been, I must say that one of the most comprehensive, and I think most one of the most transparent podcasts I ever had, because your answers are different from the other PDs I have interviewed. And I think your approach, what I would say, and some people don't like when I say that, I feel that there's a lot of talk about DEI, diversity, equity, and inclusion. And of course, the bigger the institute, the more the emphasis they have on it. But a lot of time, what I have felt that when it comes to applications, they don't walk the talk. But I think just interviewing you, the things which the way you have described things and the way you and your program has been doing things, that's for me, it's very unique because that's not I have seen, and maybe I have limited exposure. But in all honesty, that's not something I have seen. So, first of all, I would like to thank you on behalf of me and all of the IMGs that
Thank
what you are doing is it's a huge thing, and not only IMGs, but I think that includes AMGs as well because all the AMGs, whether they're MDs, DOs, but whenever I have talked to them, they actually are big advocates of DEI, and they feel that competition should be fair.
you.
And so, first of all, please accept my gratitude for doing what you are doing, and please
Thank you.
carry on what you are doing.
Thank you so much for your kind
No,
words.
absolutely. My last question, not a question, but would request a concluding comment for all people that would watch this podcast, especially the IMGs, that what would be your what should they take out of this podcast? What would be your concluding message for them?
Of course. So, first of all, you got this. We know that residency match season is going to be long. It is going to be exhausting. So make use of your social support. During the interviews itself, take notes about the program. Take notes about their strengths. Take notes about the areas of improvement. A program at the end of the day is its people. So people being mainly residents. So talk to the residents, see how they look during the interaction. If they're happy, then it really equates to a supportive residency program. Otherwise, at the end of the day, you have to ask yourself what truly matters to you. But I will say that almost all the programs are going to offer you the same thing. There is a standard that is expected of all the programs by ACGME. So you will have exposure to academia, scholarship, opportunities for fellowship. So you have to ask yourself what truly matters to you in a residency program. Reflect on your values, reflect on your goals. Look for a program that aligns with your aspirations, will offer you an environment you desire. And then, the last thing that I'll have to say to everyone, have confidence in your abilities. You all have worked so hard to reach this point. You all have the potential to make a significant impact in not only your life of your family, but also life of your patients and the communities that you're going to serve. So I'll just say best of luck. You all got this.
Well, thanks a lot, Dr. Sabir. It's generally an honor touching base with you and an honor that you shared your valuable time and recommendation with us. Have a
Thank
good
you so
rest
much
of
for
your
having
day. Thanks a lot.
me too. Thank you.
Like, comment, and subscribe.